Maabuhay! Blessed be God forever. I am Nellicon Vale R. Diosanta, together with my partner, Patricia Rose Intoy, and today we will be discussing on the fascinating and groundbreaking woman, Madeline Leininger, and her theory on cultural care, diversity, and universality.
First, let us talk about the founder of the culture care diversity and universality theory. Madeleine Leininger was born in Sudan, Nebraska on July 13, 1925. Her nursing career began after graduating from the diploma program at St. Anthony's School of Nursing, wherein she was also a part of the U.S. Army Nurse Corps. In 1950, she obtained a bachelor's degree in biological science from Benedictine College with a minor in philosophy and humanistic studies. After graduation, she worked as an instructor, staff nurse, and head nurse on a medical surgical unit and opened a psychiatric unit while director of nursing service at St. Joseph's Hospital. During this time, she pursued advanced study in nursing at Creighton University in Nebraska. In 1954, Leininger obtained a master's degree in psychiatric nursing from Catholic University of America and became employed at the University of Cincinnati College of Health, where she began the first master's level clinical specialist program in child psychiatric nursing. She worked as a clinical nurse specialist in child psychiatry at the University Hospital in Cincinnati. While in Cincinnati, Leininger discovered that the staff lacked understanding of cultural factors influencing the behavior of children. Among these children of diverse cultural backgrounds, she observed differences in responses to care and psychiatric treatments that deeply concerned her. She became increasingly concerned that her nursing decisions and actions, and those of other staff, did not appear to help these children adequately. This influenced her decision to pursue a philosophical degree in social and cultural anthropology at the University of Washington, which earned her the title as the first nurse anthropologist. Aside from that, Leininger was also a multi-awarded educator, author, administrator, researcher, consultant, public speaker, and director of the Federal Nurse Scientist Program. In 1970, Leininger published her book Nursing and Anthropology: Two Worlds to Blend, which laid the foundation for developing transcultural nursing, culture care theory, and culturally based healthcare. In 1978, she published another book entitled Transcultural Nursing: Concepts, Theories, and Practice, which identified major concepts, theoretical ideas, and practices in transcultural nursing.
What is culture care, diversity, and universality? It is understanding different cultures with respect to nursing and health illness caring practices, beliefs, and values. It implies that different cultures have different caring behaviors and health illness values, beliefs, and patterns of behaviors. And its goal is to provide meaningful and efficient nursing care services according to clients' cultural values and health illness context.
The concept of human care and caring refers to the abstract and manifest phenomena with expressions of assistive, supporting, or empowering experiences or caring behaviors toward others with evident or anticipated needs to improve human condition. Culture refers to patterned lifeways, values, beliefs, norms, symbols, and practices of society that are learned and shared from one generation to another. Culture care refers to synthesized and culturally constituted assistive, supportive, enabling, or facilitative caring acts towards self or others focused on evident or anticipated needs for the client's health or well-being or to face disabilities, death, or other human conditions. Worldview refers to the way an individual or a group looks out on and understands the world about them as a value, stance, picture, or perspective about life and the world.
Culture care diversity is the variation or differences in care beliefs, meanings, patterns, values, lifeways, and symbols of care within cultures and human beings. Culture care universality. It is the commonalities or similar culturally based care meanings, patterns, values, symbols, and lifeways reflecting care as a universal humanity. Cultural and social structures dimensions. Changing patterns of structured features of a culture, including religion, kinship, political, economic, educational, technological, and cultural values, philosophy, history, and language. Environmental context. It is the totality of an environment, situation, or event with related experiences that gives meaning to human expressions and decisions to a particular environment or situation.
Ethnohistory refers to the sequence of people-centered facts, events, or developments over time as known, witnessed, or documented about the designated people of a culture. Emic refers to the local, indigenous, or the insider's views and values about a phenomenon, while ethic refers to the outsider's views or more universal views and values about the phenomenon. Health is a state of well-being that is culturally constituted, defined, valued, and practiced by individuals or groups that enable them to function in their daily lives. Transcultural nursing refers to the humanistic and scientific knowledge and practices focused on holistic culture care to assist individuals or groups to maintain or regain their health in culturally meaningful and beneficial ways to help people face handicaps or deaths.
Culturally competent nursing care. It is cognitively based assistive, caring, facilitative, or empowering acts or decisions that are made to fit with clients' cultural values, beliefs, and lifeways to offer beneficial and satisfying healthcare services. General care systems. It is culturally learned and transmitted. Indigenous, folk, knowledge, and skills used to provide assistive, supportive, enabling, or facilitative acts towards a client with evident or anticipated needs to improve human lifeway, condition, or to deal with handicaps and death. Professional care systems. It is formally taught, learned, and transmitted professional care, health, illness, wellness, and related knowledge and practice skills that prevail in professional institutions, usually with multidisciplinary personnel to serve customers.
Care is the essence and central focus of nursing. Caring is essential for well-being, health, growth, survival, and facing death. Culture care is the broadest holistic means to know, explain, interpret, and predict nursing care phenomena to guide nursing care practices. Nursing is a transcultural, humanistic, scientific care discipline and profession with the purpose of serving clients worldwide. Caring is essential to curing and healing. There can be no curing without caring, but caring can exist without curing. Culture care concepts, meanings, expressions, patterns, processes, and structural forms of care vary transculturally with diversities or differences and some universalities or similarities. Every culture has generic and professional care knowledge and practices which vary transculturally and individually.
Moreover, culture care values, beliefs, and practices are influenced in the context of a particular culture. They tend to be embedded in such things as worldview, language, spirituality, kinship, politics, economics, education, technology, and environment. It is beneficial, healthy, and satisfying culturally based care influences the client's health and well being. Culturally congruent and beneficial nursing care can occur only when care values, expressions, or patterns are known and used for appropriate, safe, and meaningful care. Culture care differences and similarities exist between professional and client generic care in human cultures worldwide. Cultural conflicts, impositions, and stresses reflect the lack of culture care knowledge to provide culturally sensitive care. The complex and diverse data of culture care can be discovered and interpreted through ethno-nursing research method.
Meta-paradigm of theory. Three kinds of nursing care actions and decisions are as follows. First, cultural care preservation or maintenance. This refers to the actions and decisions that help people of a particular culture retain or maintain meaningful care values and life ways for their well-being, to recover from illness, or to deal with handicaps or even death. Second, cultural care accommodation or negotiation. These refers to the actions and decisions that help people of a designated culture or subculture to adapt to or to negotiate with others for meaningful, beneficial, and congruent health outcomes. Third, cultural care repatterning or restructuring refers to the actions and decisions that help clients reorder, change, or modify their lifeways for new, different, and beneficial health outcomes. Person. Humans are universally caring beings who survive in a diversity of cultures through their ability to provide the universality of care in a variety of ways according to different cultures, needs, and settings. Nursing as a caring science should focus ahead of traditional nurse-to-patient interactions to include families, groups, communities, total cultures, institutions, as well as worldwide health institutions in ways to expand policies and practices.
According to Leininger, health is universal across cultures but distinct within each culture in a way that represents the beliefs, values, and practices of a particular culture. It is both universal and distinct. Environment. Environmental context is the totality of an event, situation, or particular experience that gives meanings to human expressions, interpretations, and social interactions in particular physical, ecological, sociopolitical, and/or cultural settings. It is also the universality of care reveals the common nature of human beings and humanity, whereas diversity of care reveals the variability and selected unique features of a human being.
Leininger developed the sunrise enabler to depict the essential components of theory. The sunrise enabler symbolizes care as a rising of the sun. The upper half of the circle depicts components of the social structure and worldview factors that influence care and health through language, ethnohistory, and environmental context. These factors also influence the folk, professional, and nursing systems, which are the middle part of the model. The two halves together form a full sun, which represents the universe that nurses must consider to appreciate human care and health. According to Leininger, nursing acts as a bridge between folk or generic care and the professional care system. Three kinds of nursing care decisions and actions are predicted in the theory: culture care preservation or maintenance, culture care accommodation or negotiation, and culture care repatterning or restructuring. The sunrise enabler depicts human beings as inseparable from their cultural background and social structure, worldview, history, and environmental context as a basic tenet of Leininger's theory. Gender, race, age, and class are embedded in social structure factors and are studied. Biological, emotional, and other dimensions are studied from a holistic view and are not fragmented together. Theory generation from this model may occur at multiple levels, from the micro-range or small-scale specific individuals to study groups, families, communities, or large-scale phenomena.
Leininger has developed four other enablers to assess nurse researchers in their use of the ethno-nursing method with regards to the theory. The first is the observation, participation, reflection enabler. This is used to facilitate the researcher in entering and remaining with informants in their familiar or natural context during the study. The researcher gradually moves from the role of observer and listener, transitioning to that of participant and reflector with the informants by moving slowly and politely with permission. The researcher does not disrupt and therefore is able to observe what is naturally occurring in the environment or with the people. Second is with the stranger to trusted friend enabler. The nurse researcher is able to learn much about oneself and the people and culture being studied. The goal with this guide is to become a trusted friend as one moves from distrusted stranger to trusted friend, and different attitudes, behaviors, and expectations can be identified. This process is essential for the researcher to become trusted such that honest, credible, and in-depth data may be discovered from the informants. Third is the domain of inquiry enabler. It is a process used by a nurse researcher in each study to clearly establish the researcher's interest and area of focus. According to Leininger, the domain of inquiry is a succinct, tailor-made statement focused directly and specifically on culture care and health phenomena, stating questions or ideas related to the focus of the study, its purpose, and goals. Fourth is the acculturation health assessment enabler. This is another important guide used with the method. According to Leininger, it is essential when studying cultures to assess the extent of the informant's acculturation as to whether they are more traditionally or non-traditionally oriented in their values, beliefs, and general life ways. This enabler is used for both cultural assessments and ethno-nursing research studies.
Acceptance by the nursing community. In terms of practice, nurses need to be prepared to provide culturally competent care as the world becomes more culturally diverse. Some nurses experience culture shock, conflict, and clashes as they move to areas without transcultural nursing preparation. Nurses who travel and seek employment internationally experience cultural stresses. Therefore, transcultural nursing education is imperative for all nurses worldwide. Certification of transcultural nurses by the Transcultural Nursing Society provides a major step toward protecting the public from unsafe and culturally incompetent nursing practices. Accordingly, more nurses are seeking transcultural certification to protect themselves and their clients.
In education, greater demands for comprehensive, holistic, and transcultural people care to protect and provide quality based care and to prevent legal suits related to improper care with the increasing public awareness of healthcare costs, different cultures, and human rights. It is increasing numbers of nursing curricula emphasize transcultural nursing and human care. One of the early programs to focus on care was presented during the 1970s at Cuesta College in California, where care was developed as a central theme for an undergraduate nursing program. Research. In research, nurses are using culture care theory worldwide. It is specifically focuses on culture care using ethno-nursing research method to examine the theory. Instrumental in opening doors to transcultural nursing in many organizations. Transcultural nurses have stimulated other nurses to pursue research in nursing as reported in the Journal of Transcultural Nursing.
Theory analysis and evaluation. In terms of simplicity, the theory offers a broad holistic, and comprehensive perspective of human groups, populations, and species. Broad or generic concepts are well organized and defined for study in specific cultures. It is also relevant worldwide to guide nurse researchers in the conceptualization of research approaches to study culture. Generality. The theory demonstrates the criterion of generality because it is a qualitatively oriented theory that is broad, comprehensive, and worldwide in scope. It also addresses nursing care from a multicultural worldview perspective. It is also applicable to groups and individuals who have a goal of rendering culture-specific nursing care.
Empirical precisions. It is researchable. Ethno-nursing qualitative research has been in the primary paradigm to discover largely unknown phenomena of care and health in diverse cultures. Derivable consequences. Rendering culture-specific care is an essential goal in nursing. It places the transcultural nursing theory central to the domain of nursing knowledge acquisition and use. It is highly useful, applicable, and essential to nursing practice, education, and research. The concept of care as the primary focus of nursing and the base of nursing knowledge and practice is long overdue and essential for advancing nursing knowledge and practices. This theory could be the means to establish a sound and defensible discipline and profession guiding practice to meet a multicultural world. That's the end of our report. Thank you for listening.